Hi, I'm Nowakowski, the author of Hope is a Four-Letter Word, Riding the Emotional Roller Coaster of Illness Management. I want to thank you for coming to visit the page for my article. I'll take a little bit of time to introduce the article to you and talk about some of my goals for publishing the article and also connecting with you, the reader. So this article really adds to the diverse literature that already is out there on illness management, which is the process of adapting to and learning to live with a chronic condition. What my article contributes is information about what experiences of daily life with a chronic condition tell us about aspirations, expectations, and how we negotiate those when we live with a variety of different persistent health conditions. And also, it talks about the intersectionality of these experiences with the diverse social locations that we all occupy in our lives. So this is an important research topic because the illness management literature has a lot of really rich information about large and formative moments in the journey of living with a chronic condition. Things like when a person gets their diagnosis, a major hospitalization or a surgery, or the process of first disclosing to their family and friends that they have a chronic condition. But what the illness management literature is less rich in is information about kind of the daily grind of living with a chronic condition. What are those little ups and downs that we experience on a daily basis that we then respond to in a context not only elastic to our health experiences and our knowledge of our condition, but also to our social location and specifically our privilege and our disadvantage that we've experienced in other domains of social life? So what I have found from doing critical autoethnography, analysis of my own experiences, is that illness management is not a sort of end zone that people get into where everything just feels okay all the time. Illness management is, as Kathy Sharmaz suggests, a process of establishing a new normal in your life. But this doesn't mean that you don't experience hope and disappointment. What it does mean is that your expectations have changed to accommodate that sense of hope and disappointment and dynamic shifts between the two. So I liken illness management to a roller coaster that people ride every day, just like the experience of chronic illness itself. But the difference between an illness management scenario and where you are when you're earlier in the process is that you've kind of bought a ticket to ride and you know what to expect. So you still experience hope when you maybe encounter a new treatment option that you'd like to try, which is what inspired me to write this autoethnography, and disappointment if it doesn't work out or if you experience adverse side effects that you then have to manage. This autoethnography is about my experiences with a drug called pilocarpine, which treats some of the symptoms of the autoimmune disease that I live with. Specifically, it allows me to talk to you for this length of time without choking, without losing my voice, without feeling like my mouth is so dry that I'm literally going to pass out. And pilocarpine is a drug that helps people to produce saliva. It was first developed for treating the consequences of chemotherapy in people living with cancer, but was then later expanded to use in populations that have diseases like mine. I have an autoimmune disease that affects all of my mucous membranes. It is very similar to cystic fibrosis. And so my dentist recommended pilocarpine a few years ago to treat something called burning mouth syndrome. And in the process of trying pilocarpine, I really had a lot of experiences that showed me something that was missing in the illness management literature, and so I started to reflect critically upon these experiences. So in terms of contributing to sociological knowledge and practice about health, one of the core things that I learned from going on this journey trying this drug is that often our social responses to illness management are not necessarily realistic. There is often this expectation from other people and even from ourselves that we are just all better now when we get into a scenario where we're doing illness management. And there are other holdovers that we can see of the sick role way of thinking about sickness. Either you're sick or you're well, either you are functioning or you're not, either things feel normal or they don't. When in fact the reality of daily life with a chronic condition is much more nuanced and much more dynamic. So I'm hoping that this article will help people with persistent conditions to really modulate expectations about what to expect in a treatment journey and also in interacting with others and having conversations about living with a chronic condition. It can also help people who do not have any kind of chronic condition to formulate reasonable expectations about what people who do have chronicity in their lives might be experiencing, and to really understand those experiences in an intellectual manner, even if you can't relate to them firsthand. Finally, I want to stress that part of my goal of doing this autoethnography is to stimulate discussion, to get a dialogue going between scholars who themselves experience chronic conditions and those who do not, and to really have a diverse intersectional dialogue about all of the little nuances of illness management and how we modulate our hopes, our expectations, and our negotiation strategies on a daily basis. So I strongly encourage you to follow up with me by email and connect with me if you are interested in participating in this dialogue. You can email me about your own experiences, reach out to me for support. You can email me about other types of scholars that you would like to connect with, a project that you're planning, and I especially would be interested in hearing from you if you're interested in public sociology and/or advocacy surrounding your experiences and/or scholarship about chronic conditions. I have a large public sociology project that started out of some of these experiences that would be much the richer for your contributions. So please follow up with me. I would love to hear from you. And once again, I really appreciate you taking the time to read my article. Thank you.